Before I start this, let's set some rules for what makes good and bad arguments. These rules will apply in every future video I make. That way you have the best understanding and always backed up by good quality evidence. I won't be taking arguments seriously if they're based on fallacies. For example, if you tell me, rosemary oil is great for hair loss, it worked for me, that would be an anecdotal fallacy. Or if you say,
Mate, real men just go bald. Baldness is a sign of masculinity. Makes you more serious. Bitches love that. Why are you trying to keep your hair, huh? You want to be a woman or something?
that would be appeal to ridicule fallacy. Finally,
Beta, natural is better for you. Finasteride is very unnatural pharmaceutical chemical. Poison.
that's an appeal to nature fallacy. Essentially, we're talking about arguments that are both lazy and easy to make based on invalid reasoning. I won't take these arguments seriously, but I will entertain them here and there just so I myself wouldn't be guilty of the fallacy. My only exception to this would be if the argument I'm responding to is a conspiracy theory style argument. Essentially something like, Finasteride is just a big plot by the Jews to turn us all into femboy simps. DHT is what makes us men. Without it, we're going to be easily controlled. Now, these kind of arguments will be dismissed on the spot because I know already that there is no reasoning with such people. Any evidence I give them will be disregarded because this is apparently what the higher-ups of society want the evidence to be. Oh, you sent me a study? The study proves me wrong? Well, that's just what they want you to think. The study is bullshit. Open your eyes, man. Some people just can't be reasoned with. And no, me using a study to back up my claims is not appeal to authority. Appeal to authority is the fallacy where your only argument evidence is basically an expert said so. That's very different to citing actual research. Throughout videos like this, I will always be going by the hierarchy of scientific evidence. Here it is now. As you can see, the expert's opinion, the actual appeal to authority argument, sits at the lower end of this. I will always be basing my arguments on the best research available according to this hierarchy. So if there's an in vitro study saying one thing, but a high-quality meta-analysis saying something else, I'll be going with the meta-analysis every time. The only time you'll find me basing my final point on lower-tier evidence is when there is just nothing else available. But even in those cases, I'll be making it clear to you that further and better research is required. The lower-tier evidence I do rely on will almost never be the expert's opinion or case reports, because those are both fallacies. These are my ground rules, and I think they're fair. If you, the viewer, hold these rules as your standard for anyone you listen to, that will protect yourself from being misinformed, and it will prevent people like me from giving you bad advice. Let's start off with a good old rat study, where after having 1 milligram injected into them daily, there were sexual and depressive symptoms that persisted even after withdrawing from the drug. This sounds alarming at first, but there are two things to take into account when it comes to rodent studies. Firstly, these rats were taking 1 milligram daily. This may sound reasonable considering this is the same dose that we take, but these rats only weighed 200 grams. Therefore, this is the equivalent of an average human taking 450 milligrams daily. Secondly, the role DHT plays in rats is different from that of adult humans. We know this because we have human studies showing that taking 400 milligrams is generally well tolerated with no case of persistent side effects. We already have mountains of human data to base our opinions on. This would give a much clearer picture of the reality around finasteride. Remember what I said earlier about how the meta-analysis beats the in vitro study? Well, the same thing would apply here. The human studies would beat the rat studies, obviously. But even with human research, it's important to analyze the quality of the data we rely on. For example, Here's a study consisting of people using finasteride and having depressive side effects. This only consisted of 3 men supposedly suffering. They were compared with 5 control subjects described as healthy patients. Now, when it comes to linking finasteride with depression, it's very important you have the right control measures. After all, these young men were taking it to fight hair loss, which by default is depressing, go figure. How do you confirm that these symptoms are due to finasteride and not the initial hair loss that caused them to take it? This wouldn't be as simple as just comparing ex-finasteride users to non-users. You would have to control for many things like the severity of the hair loss and the age of the patients between these groups. These two alone would both determine how the patient is mentally impacted by their hair loss. Now, I only listed 2 factors here, and I couldn't find any indication of this study using this as a control. I couldn't even find if the healthy subjects even had hair loss. Studies like these, and of course rodent studies, are what the anti-finasteride Norwood 8s cling onto for their narrative. These are just 2 examples that I use to make you aware of a few things to look out for when someone cites research to prove their point. There are plenty of studies out there for anything. I can pull any lie out of my rectum and find some research out there in line with it. What matters is the quality of the research. Now, rather than debunking dogshit, I'm more interested in presenting real-tier evidence. Let's start with sexual side effects. This will include anything from loss of libido to less intense orgasms to complete dysfunction. I'll start off with a 7-year study consisting of 17,000 men. They were all over the age of 55 and using finasteride 5 milligrams daily to treat their prostate. Now, I should mention that old age and prostate issues are both factors that impact sexual function negatively. Not to mention the dose they were taking is 5 times the standard dose we use for hair loss. However, despite all this, the negative impact finasteride had on these men, on average from a 100-point scale, was only 3.2. This over time diminished to 2.1 points. There were no side effects that persisted after discontinuation. So, those of you afraid of starting finasteride, just ask yourselves, do you really believe that extra 2.1% of your drive is worth going bold for? I'm sure there are many of you who sit in your dungeons cooming 7 times a day who could use a bit of a lower drive. Hell, don't take finasteride, and that 2% will only ever be used in your right hand. Up next, we have a double-blinded placebo-controlled study consisting of over 1,500 men treating hair loss. These men were from the ages of 18 to 41. Some of them were taking 1 milligram of finasteride, and the others were just given a placebo. Side effects occurred in 4% of men taking finasteride and 2% taking placebo. Again, no instances of permanent side effects after stopping. This study suggests that the risk of this side effect from taking finasteride is only 2 times higher than taking placebo. Now let's confirm this. In this meta-analysis consisting of 11 studies about finasteride 1 milligram, with over 4,000 total subjects, the relative risk of sexual side effects was 1.66. This means that the risk was only 1.66 times greater than taking placebo. Now, admittedly, this is a rather small sample size for a meta-analysis, so we'll move to an even bigger one, looking at 5 milligrams. There were over 20,000 men using finasteride and over 20,000 using placebo. Throughout 17 studies, the mean follow-up was 99 weeks, and it was found that the probability of sexual side effects was only 1.5 times higher than placebo. So, in a nutshell, you are not in a position where you have to choose between losing your schlong or looking like one. The chances are you'll be just fine. Now, depression. I could waste my time going over small sample studies or uncontrolled studies or rat studies or any PFS study with selection bias. Or I can tell you that on every large-scale control trial looking at finasteride side effects, depression was just not reported or found in anybody. Next, gyno. Now, I'll be honest with you. After treating my hair loss, despite no longer being afraid of the fear-mongering, gynecomastia was the one side effect I was still afraid of. After all, nobody wants bitch tits. And unfortunately, that does happen to some finasteride users. But I think it's still rare enough to warrant taking the chance in the name of saving your hair. And I think you would agree. So in this study, where it was looking at 5 milligrams of finasteride, out of 14,722 men, 42 of them reported having gynecomastia. This equates to 0.3%. Now, with this side effect, and with all of them in general, the risk tends to go down the longer you're on the drug. This disproves the idea that, you taking this treatment for life will put you at some risk of getting it later on in life. No, in fact, the longer you take it, the safer you would be. And guys, please take into account your nocebo effect and, placebo results in general. Don't underestimate how strong the nocebo effect can be. In these studies, there are people who were on the control group who are taking placebo. They had side effects, not only things like sexual or depressive, but things like gynecomastia they were having from placebo. So if you really want to steer clear from the risk of side effects, you have to work through the fear-mongering. The more scared you get, the more at risk you will be. This is typically a reason as to why I don't recommend starting at lower doses, because think about why you're doing that. You're doing that out of fear. The correct thing to do would be lowering the dose if you experience side effects. But if you're doing that right off the bat, you've proven to yourself and to me that you're scared, which in turn would mean you've let the nocebo effect control you. So what do you do if you get side effects? Well, if we're going to talk about side effects like, sexual side effects, then the best thing to do would be to lower your dose. It has been shown actually that taking lower doses can actually lower the risk of side effects while still maintaining the efficacy of hair growth and hair maintenance. In fact, there was a study done, a study on 414 Japanese men. Some of them were using 1 milligram, the others were using 0.2 milligrams, and some were on placebo. Decreased libido occurred in 2.9% of the men in the treatment group and 1.5% of men in the treatment group for 0.2 milligrams. So, lowering the dose did reduce the risk of side effects. The same side effects were found in 2.2% of the men in the placebo group, and once again, there were no persistent side effects. So, the main takeaway from all of this regarding the side effect persistency is kind of that this isn't a real thing. There are no persistent side effects with finasteride. And it would be fallacious to look at Reddit claims or people who put 2 and 2 together on their own, because they have no way of confirming that if it's actually finasteride. You have people saying that, not only are they even reporting side effects that don't exist with finasteride, but there are people making the claim that after using it for 5 or 10 years, the side effects kicked in and then persisted when they stopped. How would this make sense? Wouldn't it kind of defeat the possibility that it was finasteride if you've been fine for so many years? Especially considering that, as I mentioned earlier, the risk of side effects decreases the longer that you're on it. Not to mention the fact that erectile dysfunction, depression, these are common conditions. You can't just blame finasteride by default. 10% of men in their 20s have some degree of ED. So that would be the first step, lowering your dose. You can do this. I think the lowest dose you can get to is 0.2 milligrams 3 days a week. Any lower than that, I think you might be hindering on your potential regrowth or maintenance. However, do give yourself some time before you do that. It's been shown that even in majority of cases, side effects go away with continued use as your body gets used to the drug. So give yourself a few months. Now, if that doesn't work, believe it or not, you could consider dutasteride. I know it's a stronger drug, but the side effect profile is actually the same. In fact, some research suggests it might be slightly lower, and there have been many reports of people claiming that, after getting side effects of finasteride, moving to dutasteride got rid of those effects. So that might be worth a try. Do note dutasteride has a longer half-life, so if you do get side effects from that as well, they may stick around for longer, but again, they won't be persistent. Now, in regards to gynecomastia, this isn't as simple as just stopping and then it goes away. It's a reversible side effect, but reversible through surgery. It may go away on its own if you stop the drug as soon as possible and it doesn't develop too far. But let's say that you waited too long and it's fully developed beyond any point of completely going away by itself. You can get the preemptive surgery, where not only will they remove the breast tissue you have, they can remove the glands that are producing the breast tissue. They won't remove all of it because that would put you at risk of concave nipples, but removing most of those glands theoretically should make it safer for you to take finasteride again without the breast tissue coming back. But again, I would do that at a lower dose. Now, if oral treatment just isn't for you, you could consider using topical finasteride or topical dutasteride, though there are some questions about that's efficacy. But topical finasteride should be okay. Either that or even topical anti-androgens. Now again, there's less data on these, so ultimately it's your choice and you have to make that decision for yourself.